Hello everyone, this is Chadi from CVI 2023. I'm really privileged to be with Dr. Tara Holder, who is endovascular interventionalist and interventional cardiologist, presenting a very challenging case at CVI 2023. Tara, thanks for being with us.
Thank you so much for having me.
Yeah, so let's go through the case. It's very challenging. We talked about it offline. Let's start with the presentation.
So this was a case that I did during my interventional fellowship with my endovascular mentor, but basically a case of a young woman who came in with a blood clot in her iliac vein, and at the time she was also pregnant. She had previously had a blood clot in that vein a few years prior, and someone placed a stent in there at the time. And so when she presented, it was actually this stent had clotted. So it was kind of challenging because you don't want to use x-rays in a patient like this who's currently pregnant with now this acutely clotted iliac vein stent.
Especially in the pelvis. Yeah.
Exactly. And so, we tried conservative therapies and they didn't really help. So the plan was then to use kind of non-X-ray modalities to open the stent and place a new stent. And so...
And she presented with a new DVT with phlegmasia and the pain.
Not phlegmasia, but just lower extremity swelling and pain.
Yeah.
That did not get better.
May I ask you, why did they have a stent to start with?
Because a few years prior she had a DVT, and whoever treated her at the time thought that she had an area of compression in that iliac vein and that required stenting.
Like a May-Turner?
Yeah,
kind of vibe? Okay.
Exactly.
Okay, all right.
So
that's very challenging, yeah. You're going to do that without...
without fluoro.
Yeah.
Exactly.
Okay.
So we were able at this time to get access in the thigh and actually use IVUS, so that's intravascular ultrasound, to then try and figure out what the issue was with this stent. And we determined that actually the initial stent actually missed the area of compression. And so then we were...
Proximal or distal?
Proximal.
Proximal.
Exactly.
So the stent was proximal to the lesion?
The stent was just distal to the lesion and it missed the compression, which was just proximal.
Compression, interesting.
Yeah.
So you got access ultrasound, vein, unilateral.
Exactly. IVUS.
Ipsilateral, sorry.
Yeah.
And then went with the what wire?
Just an 035 wire.
Okay.
We were able to cross the stent that had thrombus in it.
Blindly?
Yeah, blindly. We actually knew it was there because we got a PAC, so we knew we were at least in the right atrium.
Good.
And then we used an 035 IVUS to then try and figure out what the issue was with the stent, and that's what we determined.
Interesting. Okay. So what was your treatment strategy?
Using IVUS, we actually did mechanical thrombectomy of the stent because it was pretty acute still, the thrombus. And then we placed another stent across the area of compression. And afterwards, we actually brought her back a month later, and she had resolution of her symptoms, and just using ultrasound, we were able to determine that the stent was actually remained patent.
Nice.
So.
And in terms of thrombectomy, what device you use?
For this case, we had used the Inari flow retriever.
Flow retriever,
Yep.
okay. And you retrieved some clots?
Yes, so we were able to almost completely remove all the clot, because I said it was more acute, subacute clot, which is why I think we wanted to pursue it early before it became more chronic, and that would be a different issue.
That makes sense, yeah. All right, so and then she was left with anticoagulation?
Yeah, so she went ahead, had a successful pregnancy and delivery, remained on anticoagulation for provoked DVT.
What agent you use?
During pregnancy was Lovenox, and after pregnancy, apixaban.
Apixaban, nice. Okay, well, congratulations.
Thank you.
I mean, especially as you said, wiring the blindly is the most challenging, but the IVUS is a blessing to show you at least you are luminal and on the right track.
Exactly. Yeah. So yeah, we were very pleased with the outcome, and she's doing super.
Yeah, and the other challenging part is that this procedure wasn't done in your institution, so you don't have any reference images to see
what exactly was the initial issue.
Exactly.
Right.
Yeah. Thank you so much, Tara, for sharing with us this challenging case, and thanks for your time.
Thank you.
Please watch these videos and others on CVI YouTube channel. This is Alraies from Austin. Thank you so much.
Thank you.